An article published in the Annals of Internal Medicine highlights OpenNotes, a new initiative that could revolutionize the way doctors share medical information with their patients.
The OpenNotes project takes advantage of the fact that we all have a right to access our own medical records. The problem is that patients often have to jump through several hoops or pay sometimes non-trivial amounts of money to get copies.
Funded by the Robert Wood Johnson Foundation, OpenNotes is a one-year pilot program where more than 100 doctors from across the country will invite as many as 25,000 of their patients to read online the notes written after a doctor's visit.
I think this may be a real step in transforming the patient and provider relation. There's lots of talk about shared decision-making. There's lots of talk about the level playing field. There's lots of talk about not talking down to those whom we serve. But the question is how to make it more than talk. And I think convening around a common instrument and eventually creating it together will go a long way to really making that change.
We talk about so many different issues that sometimes when I get home I forget. And to be able to go back and get that information would be really valuable for me.
While most doctors and many patients like this one think OpenNotes will help patients take more control of their health care, there are questions.
Patients worry about what their doctor will say about them. They bring up issues of trust. Doctors worry primarily about time.
It just shouldn't be any more work, because if it's more work, we have barely enough time to do the things we do now.
At the end of the 12-month study, investigators will ask both the doctors and patients if the note should once again be closed, or if this type of transparency is here to stay.